Welcome to a special edition of Inside the Host with your favorite doctors, Dr. Mutation, Dr. Arias, Dr. Culture, and Dr. Phage.
Hello, and welcome to a special edition of Inside the Host. I'm Dr. Brandon Arias, and these are my colleagues, Dr. Brandon Phage, Dr. Melissa Mutation, and Dr. Casey Culture. Today we'll be talking about a very serious condition called Methicillin-resistant Staphylococcus aureus, or also known as MRSA. What do y'all think of the disease?
Well, I've seen this a lot in my time at the hospital. What makes it so deadly is that the carrier doesn't show any signs or symptoms. It has been reported that nearly 25 to 30% of the population carry this disease in their nose. However, only 2% are carriers for MRSA. Everyone should be aware of symptoms, prevention, and treatment of MRSA. MRSA infections can occur in any geographic location and anywhere on a person's body and can affect anyone. Patients in a healthcare setting are most at risk of being infected with MRSA.
Well then, make sure y'all can stay away from me. Anyways, patients with a weakened immune system or an illness leaves them vulnerable to MRSA. It's an infection, so post-surgery wounds or untreated wounds and even catheters can make it an easy entry for MRSA to enter the body.
So what are you saying exactly? What is the most common way we can avoid this problem?
Well, common ways could include surgical wound infections, urinary tract infections, bloodstream infections, and pneumonia. When patients get MRSA in healthcare facilities, the infections tend to be severe. It is for this reason that healthcare personnel must follow infectious control treatments, like washing their hands properly, especially going from patient to patient. This even includes the visitors in the hospital and the guests. They should wash their hands and be cautious of MRSA too.
You've been quiet over there, Brandon. What can you tell us about MRSA?
Well, I can tell you the common symptoms and what you would find within the disease. For instance, you could get a skin infection and very well be MRSA, especially those that have a palpable fluid-filled center. Could be yellow, could be white, it could have a little head. Patients can usually complain of a spider bite. So anything and everything that looks like it could be infected, hurry up and take good precautions, clean it up, and then go to your doctor. As said earlier, you can get it from surgical wounds or from the bloodstream, the lungs, from catheters. But as far as treatment-wise, that's another story. Dr. Phage, I know you're pretty good with this.
As a matter of fact, I am pretty good with it. First of all, do not attempt to treat it yourself, because you can only make this infection worse for yourself, and you might even spread it to those around you, like your family, your friends, maybe even your pets. I guess the best way to start would be washing your hands thoroughly and making sure to cover the infected area with some kind of bandage, perhaps even some antiseptics and disinfectants would help a lot. The treatment can include healthcare professionals, and normally during the infection they'll prescribe you antibiotics. Caution you should take all your antibiotics. Never ever leave your pill bottles with any pills inside of them. I can tell you from personal experience, not a pretty sight when you're not taking your antibiotics, people. So, what else do you know about this infection, Dr. Arias?
Well, thank you, Dr. Phage. One of my old interns made a video of her and her classmates on MRSA. So let's take a look.
Hey there, get your pen out your mouth, because real quick, your health could turn for sound. There's bacteria on everything that we touch that is waiting for a warm host flora. Found on all of our skin can resist some drugs like methicillin and wreak havoc on an immune system. Symptoms go, then come back again. That's why we're talking about MRSA. You all should know about MRSA. It can destroy your skin, make you sick from within, even bring your life to an end. That's why we're talking about MRSA. You all should know about MRSA. It can ruin your day, prolong a hospital stay. Let's work to keep MRSA at bay. Some peeps can be colonized with a germ that can make others go sick. So be mindful of everything that you do. It can prevent ugly lawsuits. Guess what? Just by washing your hands, we can break the chain of infection, man, and the number of MRSA cases decrease. So prevention is the main cue. That's why we're talking about MRSA. You all should know about MRSA. It can destroy your skin, make you sick from within, even bring your life to an end. That's why we're talking about MRSA. You all should know about MRSA. It can ruin your day, prolong your hospital stay. Let's work to keep MRSA at bay.
That's it.
I think.
You were right. It was interesting.
I can see why she was your intern.
Well, you can tell I enjoyed it. MRSA.
Well, as I said earlier, MRSA is big in the hospital setting, but you can also happen to get it in your surrounding community. Some groups have an increase of chance of encountering the bacteria are athletes, coaches and athletic directors, family caregivers, healthcare providers or personnel, your team healthcare personnel, the school officials, and even students themselves. To prevent the spread of MRSA, everyone should practice good personal hygiene. Take care of their skin, cover wounds and keep them clean. Wash and dry hands frequently, especially before and after caring for wounds, preparing food, or eating.
Hey, Brandon, how hot do you think it is outside today?
I don't know, probably about 96 degrees. Why?
Did you know that the ideal temperature for Staphylococcus to grow is 96 degrees Fahrenheit? I mean, generally, people infected with MRSA stay infected for about 10 days. And it is summer, and the last thing that these kids want to do is stop playing. That's why it is essential for them to continue with the good hygiene and with including the sports directors and keeping the maintenance on locker rooms and sports equipment to keep that Staphylococcus clean off of your equipment, clean off your lockers, and clean off of you.
A little insight, Dr. Phage. Is there anything else we should recap on methicillin-resistant Staphylococcus aureus?
MRSA could be a dangerous type of staph bacteria that is resistant to certain antibiotics and may cause skin and other infections. And to finish up, you can get MRSA through direct contact with an infected person or by sharing personal items such as towels or razors that have been touched by infected skin.
And if you or a family member have a skin infection that shows any signs of redness, swelling, heat to the touch, or fever, you should contact your healthcare provider right away for evaluation and treatment.
Thank you all for tuning in to Inside the Hose. I'm Dr. Brandon Arias.
I'm Dr. Melissa Mutation.
Dr. Casey Culture.
And I'm Dr. Brandon Phage.
Stay sterile, America.
This is a rap about MRSA. Let me tell you something about this thing called MRSA, an infection from bacteria, and yes, it'll hurt ya. This is caused by germs, so washing our hands will clean us. You do not want this methicillin-resistant Staphylococcus aureus. You're likely to get infected if you're